Thank you very much. Thank you all for coming. And someone mentioned before, who's going to be paying for all of this debt that this president has put upon us? She is!
Yeah.
She is! Thank you very much.
No.
Okay, I'm here, ladies and gentlemen, to tell you about a time when I became very sick about 12 years ago. It started off with very severe bad headaches. And I immediately went to my physician, who I was under a private plan with my employer, which was pre-tax, was tax deductible, and my employer paid 60%. That was a good deal. Okay, I got excellent care for that price. And I went to the doctor, and what he did was say, let me send you to a couple of different specialists. And specialists under an Obamacare is not going to exist like it does today. Immediately, I was 3 different specialists. An optometrist, in case it had something to do with my eyes, a urologist, and a neurologist. And it was the neurologist who recommended that I have an MRI. And thank goodness, because if I didn't have that MRI, I wouldn't have known that I had a pituitary tumor that was growing for about 5 years. If it would have been able to continue to grow, it would have killed me. I would have been dead by now. Okay? After the neurosurgeon sent me for the MRI, I had the MRI appointment within a week. Okay, I'm not paying a dime for anything. Of course, the insurance company is paying. I'm not making any phone calls. I'm not doing anything. They are taking care of me. After the MRI revealed the tumor, I had to see an endocrinologist. The endocrinologist gave me 2 options. I could treat the tumor with steroids and hope that it shrinks, or I can have it surgically removed. It was my decision. I wanted it removed as soon as possible. From the time that I first saw my physician to the time that I had the surgery, 2 months elapsed. That's it. 2 months. Okay? Now, mind you, it was a really bad headache. It was so bad that I started to convince myself before I realized what it was, that it didn't exist. I would never have imagined to have an MRI done. Never. In fact, when they told me I have to have an MRI, I was like, why? What do I need an MRI for? You understand? If it wasn't for those doctors recommending the right course of action because they didn't know what it was, I would have never had it done under an Obamacare. They would have never sent me for an MRI. In any event, even if they did authorize an MRI, it would have probably taken years. Okay, where would I have been with a constant headache for years? Okay, it's impossible. Okay, we have the best care in the U.S. Now I had to go see a neurosurgeon, and I had to pick the neurosurgeon of my choice. I went to 3 different neurosurgeons. Again, back to back, appointment after appointment. I went to NYU, I went to Mount Sinai, and I went to Columbia Presbyterian. Now these are good hospitals. And I had my choice, and I picked the surgeon at Columbia Presbyterian. I had the surgery done, they removed it, it was benign, and everything was fine, okay? What my government did for me at the time, like I said, I was employed, I had to take some time off. It was a 5-day stay at the hospital. I collected disability. Everything worked out. I had some health and family, and I moved on after 2 months. And between all of this, I hurt my knee. I tore my ACL. Just goofing off, tore my ACL. About 2 weeks after the brain surgery, I had the ACL fixed as well. Hospital for Special Surgery in Manhattan. It's not a dime. Not a dime. None of this would have happened under Obamacare. So I'm here, and I drove almost 2 hours to be here. I'm originally from Queens, and I live up on New Falls. And I came down here to tell you that our president had his way back in the day when I was sick, I would be dead. I would be dead. Please, we cannot let the government take over our health care. And you know what? If they want to be in the healthcare business, quit your job and go for it. You can make a lot of money. Quit your job. Oh.
Combined.
That's right. Combined. Can you imagine? We can't even pay it. It's so much. You know, the pundits get on television, 6 million, 7 million, a trillion. This is a lot of money. We can't pay it. We don't have it. He's printing it, and she pays for it. She pays for it. Now, I'm going to fast forward to 2007. I lost my job. And I had no choice but to go on unemployment, but I worked for 10 years and I deserved that unemployment. And I had no other choice but to go on Medicaid. That's what it's there for, okay? We have Medicaid. You lose your job, you don't have insurance, you sign up for Medicaid, just like everybody else. That's what I did. I don't need the government to tell me that I can't buy private health insurance. If I can't afford it, then I'm going to be on Medicaid. And during Medicaid, I've run into a lot of problems, I'll tell you that. And if they're going to take money away from Medicaid, it's really a sorry, sorry story. I'm already waiting 16 months. First of all, I wait months for vaccines. I have another little one, a little older than her. I've had to wait 5 months to get vaccines for my children because the medical office doesn't have it. If they were privately insured, they would have it. They would have it.
They had money to bail out the banks, though.
Exactly.
They bailed out trillions of dollars.
And do you know that they're going to stop giving the elderly Social Security recipients a raise, an annual raise? The cost of living, they're going to cut that off. The time since it's been in inception, it's the first time, and the government is going to take the money away from the older people. My parents are on Medicare. They worked their whole lives. And you're going to tell me you're going to take that 5 cents away from them? This is wrong, ladies and gentlemen. This is wrong. We cannot let our elected officials do this. We have to vote them out.
What's the picture of all of you?
Say no to Obama!
Raquel's reassuring theme seems to have been choice there, and I think that's exactly what you're not going to have in the very near future. Our doctors and nurses who are out there working will not have the ability to adjust their pay schedules. They will not be able to identify and bill the way they've been doing. And anybody who's been in a doctor's office knows that you're going to wait anyway in that doctor's office for a significant amount of time, as it is. As it is. The people who are on Medicare and Medicaid today, of which even the budget office in the Congress tells us is 20 to 30% waste and fraud. 20 to 30%.
$80 million.
Okay? There's your number to start with in a program that only covers 15% of Americans. Now take the other 85% of Americans and throw them into that pot. Now our 20%, 30% margin becomes trillions of dollars. And the government will continue to spend it because obviously the taxpayers will pay for it. And what has happened in New York when we went to a program of leveling out the field? The health insurance premiums went up. We wound up getting marginally worse care. Our doctors became strained. Our clinics boomed. And things like that happened. Waiting 4 months to see your doctor. Waiting another 6 months to get your surgery. That's what's happening in Canada. That's what's happening in Mexico. That's what's happening in England. And they come to the United States to get treated. That won't be the case if Obama has his way. We have some questions. I know that we're out there, and we're going to turn the floor over